All right, so let's say that it didn't pop out like that. The next step, you said, two options, right?
Two options. So, and the way I kind of think of this again is this an implant patient or not? Most of the time in the anterior, you're going to be looking at an implant, but we all have patients that that's not the case. And if that's not the case, let's get the tooth out as quickly as possible and as easily as possible. In that scenario, non-implant patient, let's make a conservative trough. You don't have to get carried away, but a conservative trough around the buccal with a little kind of angulation into that interdental space to help you supply an elevator into that area.
Got it. So, so just a trough here, right across the facial, right?
Yep.
So I'm going to do that right now. Is that how you would do a trough?
Yeah, that's deep enough. And remember, we want sharp, clean cuts. You don't need to feather. We're not doing a crown pat.
Got it.
So just...
So maybe go, not go back and forth?
Yeah,
Got
just do it.
So right now I'm just doing 2 crown preppy.
Yep.
Got it.
There you go. Just keep going with that. There you go. And then sink it right. Good. And that's it.
And how about, I didn't do a cut right here.
Then I would sink a little bit in there. Good.
Okay. All right, so I made my little trough because, say this was not an implant patient. Then I'm going to go ahead and go with the elevator, right? This smaller elevator, right?
Yes, and you've created a spot to place that elevator.
Okay.
And so you can come in, come in as we normally do.
Right?
Yep, and just make your clockwise, counterclockwise, and a little apical motion.
So I'm going to hold it 1, 2, 3, right?
Great.
And then 1, 2, 3.
Great.
I'm going
Good.
apical, 1, 2, 3. And did you say that you also turn it the other way and do apical?
You can, absolutely, yes.
Got it, okay.
And this is a time where some practitioners do like to do more of a vertical wedge technique. There is nothing wrong with that. I don't do that too often, but it is not incorrect. You can also wedge. It just takes a while and for me.
I want to show that one more time because it's like a little nuance that I think is really important. And I want to show that really clearly to the student. So after you do the 90 degrees, according to Matt, I really love this, you'll twist and move apically.
And what you can envision is that lower blade of the elevator is engaging the tooth and driving it out of the socket.
So twist and move apically. And it kind of like bumps that tooth up. And I'm going to do that on both sides. Cool. Anyway, so let's say that we delivered that, we were able to just move.
And then you would take the
forceps
forceps and you do the same thing we did in the last video where you're seating it down on that. You may at this point not need to go down to the bony portion because you've created a little more tooth structure, and you can grab the tooth and conserve the rest of that bone, and you're going to just rotate it out.
Got it. So let's just, for the sake of learning, say that didn't work. Say I just crushed this stuff. Oh crap. So okay, now
so we have that scenario. Or we can also now say that this is an implant patient, right? And we don't want to remove more bone.
Okay.
So let's look at how we can access that tooth without bone removal. We're going to go ahead and section it. Now, sectioning a single rooted tooth can actually be difficult. It is, in my opinion, easier to section a multi-rooted tooth. So we've got to work within that confined space. We're going to use a smaller burr. I prefer a 701 or a 702 on a surgical handpiece. That's going to prevent us from just annihilating all of the tooth structure. I want you to cut right down the middle of that tooth and kind of sink that burr in. You want to get, if you can, about 2/3 down the rest of that root. And again, a sharp, clean cut. Just go on down and go right through.
So you said I'm gonna section it like this, right?
Right down the middle.
And am I going to take a little bit of? Am I going to take a little buccal bone with me?
Let's try not to, because remember, we're doing this for an implant patient.
Got it. Okay. All right, so now I cut it. It looks like it's sectioned right there, buccal palatally.
Yeah, and I know with the plastic, it doesn't cut quite as well. Remember, in real life, we want to make that sharp, clean cut. It should be one motion, done. Okay.
Okay, so you're not going to spend much time in there refining
just
anything.
boom, through, out.
Got it. Okay.
All right, so now we've created a section right through the middle of the tooth. We're going to stick our elevator down vertically.
This small straight elevator, right?
Yep.
Okay, sticking right in there.
And you're going to seat it all the way.
So I'm going to put some apical pressure right now. Yeah.
And then you're just going to twist, and you can be forceful. Twist that thing. You want to hear that tooth pop, and you want to, break off that portion of the tooth.
I think it did. So now do I?
So you're going to come. Yep, you're going to come down apically. You're going to pretend you're going to engage that bottom part of the elevator blade, just like we were doing before. Rotate clockwise in this sense, and come apical, and you're going to lift that part of the tooth out. There
Like
you go.
that.
There you go.
Nice.
Okay, and now what we've done is we've created space on that side of the tooth, right? And that's part of the socket. So now we're going to place our elevator on the side where the tooth still is. You're going to engage between the tooth and the alveolar bone, and now you're going to push the tooth into the space you've created, and then come apical and lift it out.
It's like we staged that. That's so perfect. Awesome. That's great.
Good job. You did it.